Cancer-related fatigue is one of the most common side effects for people with cancer and can happen at any time during the course of cancer, its treatment, and after treatment is complete. 80 to 90% of newly diagnosed people with cancer experience this type of fatigue at some point.
It's generally a feeling of physical, emotional, or mental exhaustion, even though you're getting enough rest and sleep. And so some patients may describe it as feeling worn out, or heaviness, or slowness, or not having the energy to do things. I think the key aspect of cancer-related fatigue, as opposed to more regular fatigue, is that it's not really completely resolved with rest or sleep. And it can interfere with daily activity and may last for a long time, even after treatment finishes. Patients will report that their daily activities are affected, things like simple hobbies or other daily routines, even their job performance may decline. Other things patients may note during the day is their mood or emotion may feel different, their hope for the future, or how they relate to their family members or friends. And their ability to cope with the treatment is harder. And so sometimes it can make some of the other side effects worse.
I would say cancer-related fatigue feels like you're tired all the time, but not just tired like I need a nap, but tired like I can't focus on daily tasks. It's difficult to get out of bed. It's hard to do all of those day-to-day things like walking the dog or making breakfast. Those things that would normally take a regular amount of energy tend to take a larger amount of energy, or it feels like they take a larger amount of energy. And so those activities that would normally feel like molehills suddenly feel like mountains.
Cancer-related fatigue is complex and has many causes that can often be difficult to pinpoint.
So most commonly, it's probably related to the cancer diagnosis itself, but many times the treatments that we provide for patients, the surgery, the chemotherapy, radiation in itself can also cause fatigue. And there could be other medicines that we're providing that may worsen the fatigue symptoms. Other conditions that patients should be aware are uncontrolled pain. Oftentimes people don't realize that the pain is not allowing them to sleep. It's making them feel exhausted, and so that contributes to their fatigue. Other things can be their psychological state. So depression, anxiety, stress can also make patients feel tired. It's that mind-body connection. And when patients are very stressed, they often have trouble sleeping at night. And so if you have disrupted sleep cycle, they're not waking up well rested. And so sleep can be another area that can be a cause or contribute to these symptoms. Other things that we sometimes see is when patients have poor nutrition, in part because of the surgery they had or the side effects from the chemotherapy. They're not eating as well, and so poor nutrition can contribute to fatigue. And other things that we need to check for are low blood counts, specifically red blood cells, also contribute to fatigue. Patients should also keep in mind that their other medical conditions may worsen while they're going through cancer treatments, so their diabetes or the hypothyroidism, heart, lung, or kidney issues.
If you are feeling fatigued while you are going through cancer treatment, it is important to tell your healthcare team. Once they are aware of your fatigue, they can work to determine the cause so that they can help you manage it and help you feel better.
That way, your healthcare team can help evaluate and treat the potential causes. So one of the things they may do is check some blood work or other simple tests. Sometimes we may find a simple reversible cause, such as hypothyroidism, low blood count. We can give you a blood transfusion. If it's really related to nutrition, having you meet with a dietitian and addressing those malnutrition needs, and something as simple as a multivitamin might be helpful. Other times we may find you might be B12 deficient or iron deficient, and providing a supplement to address those deficiencies will also help with your fatigue. Other things that their healthcare team may consider is a physical activity program. So if you're really debilitated, they may recommend something as simple as physical therapy. They may recommend seeing a personal trainer to work on an exercise program. And there have been studies that show that exercise in itself can help improve fatigue. Counseling can also be helpful. Cognitive behavior therapy has been helpful for fatigue. It may help reframe your thinking about how you're addressing your fatigue and how you're thinking through it. And sometimes mind-body strategies can be helpful as well. So things as simple as meditation, music therapy, massage, other activities might be helpful in addressing your symptoms. And lastly, you may want to talk to your medical team about any medications or supplements that might be helpful. But I think you always need to check with your medical team first before starting any new medications or supplements.
When you're tired, sometimes the solution or part of the solution is to go outside and play fetch with the dog for a few minutes and get a little sunlight. Move around. Obviously, there's a balance to that, but the idea of and this gets kind of what I try to bring to the table or offer for Kate is, do what you can to give yourself the best shot at a full day or satisfying day. Even if you need a nap, that's fine. Your body's telling you something.
I would say the best piece of advice I could give for someone dealing with cancer-related fatigue would be to know your body well enough to allow for rest when you need to rest and allow for productivity when you know you have the space to do it. So knowing your body and knowing when it's time to take a break and allowing yourself to do that so that you can come back and be productive later is really important.
Many people with cancer want to know how long it takes after treatment ends for the fatigue to subside.
I do tell patients that the more treatment you're on, probably the longer it's going to take to recover. So if it's just a minor surgery, then you might be able to recover within weeks to months. But if you've been on chemotherapy for 6 months or 12 months, then it may take 6 to 12 months to really find a new plateau or a new baseline. And so I think for every patient, you want to listen to your body, work with your healthcare team, and figure out what makes sense in terms of a recovery period.
I think managing expectations has been hugely helpful for both of us, and just learning to not place too much weight on each other as much as we can, and to understand that sometimes things don't get done during the day, and that's okay.
For more information on cancer-related fatigue and other side effects of cancer and its treatment, please visit Cancer.Net.
Cancer.Net is a great website. It's expert reviewed. It provides a lot of information, specifically in the area of supportive care, including symptoms of fatigue. So it's a great resource specifically made for patients, and highly recommend that as a source to learn more about cancer-related fatigue.